Now, though, we want to talk more about the vaccine. A lot of vaccine news coming out over the past few weeks. Now we know of at least 3 companies that have made a lot of progress with their vaccine lately, and we want to get right to an expert for you this afternoon. Dr. Virginia Bieluch is the Director of Infectious Disease at the Hospital of Central Connecticut. Doctor, thank you very much for joining us this afternoon. We appreciate it.
Great to be here. Thank you for asking.
I have to start. Are you excited about what you're hearing about all of this right now?
I think all of us in healthcare, infectious diseases, et cetera, are really anxious to hear more about the new vaccines. We don't have the data yet, but this is certainly welcome.
So many people. You're all on the front lines of all of this, and I know you'll be among the first to get it, rightfully so. So many people are ready to do whatever they can to hopefully put this pandemic to bed. When they talk about side effects, what are you hearing? What can people experience perhaps from something like this? Is it even too early to ask?
Yeah, it's a little too early to ask. We haven't heard of any major side effects that have been attributed to the vaccinations. When you get a vaccine, though, we often get a little bit of fever, a sore arm, some muscle aches, may not feel well for a day or so, and that's often attributed to a side effect of the vaccine. But what it really is your immune system is working, and that's good. And one of our concerns is that if people are in line to get a 2-shot vaccine, they may get the first one and not want to get the second one because of what was thought to be a side effect. And we encourage people, don't do that. These vaccines have been studied as 2-dose vaccines, and it's really important for you to get both of the shots if indicated. But thus far, I haven't heard about any major side effects, but we still haven't seen the scientific data yet.
Are you having a hard time when you talk to people about the vaccine? Do you hear from people who say they're, concerned, or they don't trust the pharmaceutical companies, things like that? Is that frustrating for you?
I think there's a fair amount of understandable anxiety at how rapidly this has all taken place. And I've never seen a vaccine develop this quickly. We've heard from the pharmaceutical companies that they are not interested in cutting corners and not interested in producing an unsafe vaccine. And these data are going to be reviewed by the FDA and the CDC. And I think we all have to place our trust in them and assume that they're going to do as good a job as they can as the experts in the area to validate the safety and efficacy of these vaccines. So I am hopeful. People are understandably concerned, and I get it.
Yeah. Well, Dr. Virginia Bieluch, we cannot thank you enough for joining us this afternoon and really for all you're doing and your coworkers. It's incredible right there.
Thanks a lot.
Have a good Thanksgiving.
You too.